There's a test that takes 10 seconds, requires no equipment, and according to research published in the British Journal of Sports Medicine, predicts mortality risk better than most people would expect from something this simple, standing on one leg. Researchers followed more than 1,700 adults for several years and found that people who couldn't hold a single leg stance for 10 seconds had an 84% higher risk of dying over the following years compared to those who could. Among adults in their early 70s, fewer than half could pass it. That test connects to something most people never think about directly, how blood actually gets from your feet back up to your heart, and what specifically keeps that process working, or lets it slow down, after 60. It's a question worth taking seriously, since the answer turns out to have very little to do with how many steps someone logs in a day, and a great deal to do with one specific, underused muscle action. Walking is good advice, and nothing here is meant to talk you out of it. But walking alone often isn't enough to fully address poor leg circulation, and understanding why opens up a set of specific movements that do something walking mostly doesn't. Here's the mechanism worth understanding first. Blood doesn't return from your legs to your heart passively. It has to travel uphill, against gravity, through a one-way system of veins with small internal valves. The muscle that drives this process is your calf. Every time it contracts, it squeezes the deep veins running through your lower leg and forces blood upward. The valves snap shut behind each push, so blood doesn't fall back down. This mechanism is often called the calf muscle pump, or informally the body's second pump, and it's a well-established part of vascular physiology, not a metaphor. After 60, several things tend to work against this system simultaneously. Vein walls lose some elasticity and become more prone to stretching. The valves inside them can become less effective at snapping fully shut, and the calf muscle itself, like other muscles, tends to lose mass and strength with age, particularly with extended sitting, which describes a large part of most people's day. When the pump weakens, blood pools more readily around the ankles, swelling increases, feet feel colder, and the skin in that area receives less oxygen-rich blood. Reduced comfort and confidence in movement can lead to less activity, which weakens the pump further, a pattern that tends to compound gradually rather than announcing itself all at once. It's worth being clear about why this matters beyond comfort. According to vascular health research, roughly 1 in 5 adults by age 70 has some degree of peripheral artery disease, a narrowing of the arteries supplying the legs, and many are unaware they have it. Poor circulation also slows wound healing in the lower legs and feet, which is part of why minor cuts or sores in this population can become more serious infections if not addressed. None of this is meant to alarm. It's meant to explain why the movements covered here are worth taking seriously as more than a comfort measure. Consider a composite example, drawn from patterns seen across many people in this situation, rather than any single real person. A 71-year-old who walked a mile daily, propped her feet up most evenings, and wore the compression socks her doctor recommended, yet still dealt with ankles that swelled noticeably by dinner time, feet that stayed cold even in summer, and a genuinely unsettling feeling of unsteadiness when standing up too quickly. She was doing essentially everything typically recommended, and the lack of improvement was, understandably, frustrating and confusing. What this kind of case illustrates is precisely the gap described above. Walking, elevation, and compression all help, but none of them provide the sustained, repeated calf contraction that specifically rebuilds pump strength. Once a more targeted routine, similar to the 5 movements below, replaced an exclusive focus on step count, meaningful improvement in swelling, and a subjective sense of steadiness often follows within several weeks, though never as a guaranteed or fully restorative outcome, more a genuine, incremental improvement worth pursuing. Walking does engage the calf muscle, but only briefly with each step, and for many older adults, particularly those managing pain, fatigue, or balance concerns, walking alone doesn't provide enough sustained muscle engagement to meaningfully strengthen a weakened pump. That's the gap the following 5 movements are designed to close. Movement 1. Ankle pumps. This is often the very first movement given to patients recovering from leg surgery, before they're even cleared to stand, specifically because it keeps blood from pooling during recovery. A 2025 review in the Journal of Orthopedic Surgery and Research analyzed 16 randomized trials and found that simple ankle pumping improved venous blood flow and reduced lower leg swelling in older adults, with no standing or walking required. To do it, sit with feet flat on the floor. Lift the toes up toward the shins while keeping the heels planted, then reverse. Press the toes down and lift the heels, Similar to easing onto a gas pedal. Move slowly and deliberately rather than quickly. That's 1 repetition. Aim for 20 to 30 repetitions, 2 or 3 times a day, easily done while sitting at a table, reading, or watching television. Given how much of a typical day is spent sitting, in a car, at meals, in a chair in the evening, this movement offers a way to keep the pump active during all that otherwise stationary time. It's worth understanding why walking doesn't accomplish the same thing, even though it also involves the calf muscle. Walking relies heavily on momentum. Each step is a brief, partial contraction followed quickly by the next stride, without the muscle ever holding a full, sustained squeeze. Ankle pumps, done slowly and deliberately, allow a much more complete contraction and release cycle each time, which is precisely what's needed to clear pooled blood, rather than simply shift weight forward. This is also exactly why ankle pumps are so often used in hospital and post-surgical settings, specifically for patients who cannot walk at all yet. The benefit doesn't depend on standing or stepping in any way. Movement 2. Seated leg extensions. Straightening one leg out in front of you while seated engages the large muscles across the front of the thigh and hip, the same muscles relied on to stand from a chair, climb stairs, or catch your balance if you start to stumble. As these muscles contract, they also press against the large veins running through the thigh, helping move blood out of the leg in a way ordinary walking barely challenges. This connects to something geriatric researchers track closely: gait speed, or how fast someone walks, sometimes referred to as a 6th vital sign, alongside pulse and blood pressure, because a slowing gait is one of the earlier measurable signals of declining strength, fall risk, and overall functional decline. Strengthening the muscles responsible for walking speed is directly relevant to preserving it. To do this, sit upright in a sturdy chair with your back against the seat and both feet flat on the floor. Slowly straighten one leg out in front of you, holding it for about 2 seconds, then lower it slowly rather than letting it drop. Do 10 to 15 repetitions per leg. Keeping your back firmly against the chair matters. It prevents using momentum or rocking to complete the movement, ensuring the target muscles actually do the work. As this becomes easier, a light ankle weight or resistance band can add useful load. Even 1 or 2 pounds makes a measurable difference, and older adults frequently see faster strength gains than expected, in part because they're often starting from a lower baseline. This connects back to the earlier point about gait speed in a fairly direct way. The thigh and hip muscles engaged here aren't abstract fitness targets. They're the specific muscle groups measured, indirectly, every time a doctor or physical therapist assesses how quickly and steadily someone walks across a room. A decline in these muscles tends to show up first as subtle slowing, well before it becomes an obvious mobility problem, which is part of why researchers have found gait speed to be such a useful early indicator across a wide range of health outcomes, not limited to circulation specifically. Movement 3. Supported calf raises. This movement trains circulation and balance simultaneously. The National Institute on Aging has specifically identified maintaining lower body muscle strength as one of the most effective ways to preserve independence with age, the ability to rise from chairs, climb stairs, and move without assistance. Calves are central to that, since weaker calves both slow the circulatory pump and slightly dull balance reactions, making an ordinary stumble more likely to become an actual fall. To perform a supported calf raise, stand behind a sturdy chair or at a counter, resting your hands lightly for balance, feet about hip-width apart. Rise slowly onto the balls of your feet, lifting the heels as high as comfortable. Pause for 2 to 3 seconds at the top while looking straight ahead rather than down, then lower slowly over about 3 seconds. Start with 10 repetitions, building toward 20 to 25 as strength improves. The slow tempo and the pause at the top are where the actual benefit comes from. That combination trains the calf muscle and balance system to fire together, which mirrors what the body needs to do in the split second of catching a stumble. Movement 4. Single leg balance holds. This is the exercise connected to the 10-second stand and mortality research mentioned at the start. The mechanism linking balance to circulation comes down to sustained muscle engagement. Standing on one leg requires the calf, ankle, hip, and core to contract continuously to maintain balance, keeping the calf pump actively engaged the entire time, rather than the brief, momentary contact each foot gets during ordinary walking. To practice this safely, stand next to a counter or sturdy chair, resting one hand lightly on it. Shift weight onto one leg and lift the other foot just an inch off the floor, standing tall with eyes forward, avoiding curling the toes to grip the ground. Hold for 20 to 30 seconds, breathing normally, Then switch legs. That's one set. Start with 2 rounds per side. As balance improves, gradually reduce reliance on the supporting hand until it hovers just above the surface rather than touching it. This sustained squeeze both keeps blood moving and helps retrain the nervous system's reaction speed if a stumble does occur. It's worth spending a moment on why that mortality research at the start is genuinely relevant here, rather than a scary statistic disconnected from the rest of this routine. Balance and circulation are more entangled than they might initially seem. When balance declines, people naturally move less to avoid the risk of falling, and reduced movement weakens the calf pump further, which increases swelling and discomfort, which in turn often reduces movement even more. Improving single-leg balance directly interrupts that cycle at one of its more vulnerable points, which is likely part of why this specific, simple measure correlates so strongly with broader long-term health outcomes in the research. Movement 5, the standing calf raise hold. This is closely related to movement 3, with one key difference: the hold at the top. Rising onto the balls of the feet and remaining there keeps the calf pump fully engaged long enough to actually clear pooled blood from around the ankles and drive it upward, rather than the brief squeeze and release of a standard calf raise. The evidence supporting this specific approach is substantial. A randomized trial published in the Journal of Vascular Surgery found that people with documented poor leg circulation who followed a program built around calf raise exercises significantly increased their pain-free walking distance and total walking distance without medication or equipment involved. To perform it, stand behind a chair or counter for support, feet hip-width apart. Rise slowly onto the balls of the feet, lifting the heels as high as comfortable, and hold that top position for 3 to 5 seconds, breathing normally with eyes forward. Lower slowly over about 3 seconds. Start with 8 to 10 repetitions, building toward 15 to 20 over time, always with control rather than speed. The hold is the essential element. It's what allows the sustained pressure needed to clear pooled blood rather than simply flexing the muscle briefly. The distinction between this and movement 3 is worth being explicit about, since they can look nearly identical from the outside. A standard calf raise is a dynamic exercise, up and down in a continuous motion, which builds strength and endurance well, but doesn't hold the pump in its fully contracted state for any meaningful length of time. Adding the hold transforms it into something closer to an isometric exercise for part of each repetition, and that sustained contraction is specifically what the vascular surgery research measured improvement against. In practice, this is often the single-movement clinical rehabilitation programs for peripheral artery disease build their entire protocol around, precisely because of how directly it targets the mechanism responsible for pain-free walking distance. A reasonable full routine combining all 5 takes about 12 to 15 minutes. Ankle pumps in the morning, seated leg extensions, and supported calf raises at some point during the day, single leg balance holds, and standing calf raise holds to finish. None of these require special equipment beyond a sturdy chair or counter for support, and all 5 can reasonably be done at home. A few practical questions worth addressing directly, since they come up often around this kind of routine. Does this help with varicose veins specifically? These movements support overall venous return and may modestly ease associated symptoms like heaviness or aching, but they don't reverse structural changes to the veins themselves, which is a separate issue best evaluated by a doctor if varicose veins are a specific concern. What about compression stockings? Should these replace them? No, compression stockings and these movements work through different, complementary mechanisms, external pressure versus active muscle contraction, and most people benefit from continuing to use compression garments as prescribed alongside this kind of routine, rather than substituting one for the other. Is there a wrong time of day to do these? Not particularly, though many people find doing ankle pumps first thing in the morning, before a long stretch of sitting, and the standing movements later in the day when more alert and balanced, works well as a practical rhythm. Should these be done on both legs even if only one side seems affected? Generally, yes. Circulation issues frequently affect both legs to some degree, even when one side is more symptomatic, and training both sides evenly also avoids creating an asymmetry in strength or balance. It's worth being honest about realistic expectations here. These movements are unlikely to fully reverse circulation changes that have developed gradually over years, and no single routine works identically for everyone. What the research does support is a genuine, measurable improvement in symptoms like swelling, cold extremities, and pain-free walking distance, generally over a period of weeks of consistent practice rather than overnight. There's also an important distinction worth drawing clearly. Everything described here addresses chronic, gradual circulation issues, the kind that build up slowly over months and years. This is not appropriate for, and should never delay evaluation of, a sudden circulation emergency. If you ever experience sudden severe pain in one leg, a leg that becomes pale, cold, and numb without clear explanation, or a sore on the foot or ankle that isn't healing over a reasonable period, that combination warrants prompt medical evaluation rather than home exercise, since it can indicate a seriously blocked artery or another acute vascular emergency. It's worth being specific about how these symptoms differ from what these exercises are designed to address, since the distinction matters practically. Chronic poor circulation tends to develop gradually over months, affects both legs to some degree, and produces symptoms like general coldness, mild swelling that builds through the day, and aching that eases with elevation or movement. An acute vascular emergency, by contrast, tends to appear suddenly, often affects one leg specifically and severely, and produces pain and color changes that don't ease with rest or elevation. When in doubt about which category a symptom falls into, treating it as the more serious possibility and seeking prompt evaluation is always the safer choice. On the question of progression more broadly, a reasonable approach is spending the first 2 to 3 weeks simply building consistency with all 5 movements at the starting repetition ranges described above, before focusing on increasing difficulty. Once the starting ranges feel comfortable rather than challenging, gradually increasing repetitions, hold times, or added resistance in the seated leg extension is a sensible next step. There's no need to rush this progression. For most people starting from a place of genuinely reduced circulation and strength, the first several weeks of simply establishing the habit produce the most noticeable initial improvement, with further gains building more gradually after that. To bring this together as a practical recap, ankle pumps activate the pump with minimal effort and are a safe starting point for almost anyone. Seated leg extensions move blood through the thigh and build the muscles behind gait speed and fall prevention. Supported calf raises combine circulation benefit with balance training. Single leg balance holds provide the sustained muscle engagement most closely tied to both circulation and the fall risk research mentioned earlier. And the standing calf raise hold, with its extended top position hold, is the version most directly supported by clinical research on improving walking distance in people with documented circulation problems. Walking remains a genuinely good habit, and nothing here suggests replacing it. But for the specific problem of blood pooling in the lower legs after 60, these 5 movements target a mechanism that walking alone often doesn't fully engage, and they're accessible to most people regardless of fitness level, cost nothing, and take a modest amount of time each day. One last point worth emphasizing, since it's easy to lose amid the specific mechanics of each movement, consistency matters considerably more than intensity here. Someone who does a modest version of all 5 movements most days of the week will very likely see better results over 2 months than someone who does an intense version sporadically for a week and then stops. This is a slow, cumulative process, rebuilding a muscle pump and the vein function it depends on, not a single workout that produces an immediate fix. Treating it as a small, sustainable daily habit, similar to brushing teeth rather than an occasional intense session, is genuinely the more effective approach based on how this kind of gradual physiological change tends to actually work. And it's worth remembering that the goal isn't perfection on any single day, but a routine steady enough to still be happening a year from now. This video is for general educational purposes only and does not constitute personalized medical advice. If you experience sudden severe leg pain, a leg that becomes pale, cold, or numb, or a non-healing sore on the foot or ankle, seek prompt medical evaluation rather than attempting to address it through exercise alone. Consult your doctor before beginning a new exercise routine, particularly if you have a diagnosed vascular condition, arthritis, or balance concerns. Sources for this video include a 2025 systematic review published in the Journal of Orthopedic Surgery and Research, research published in the British Journal of Sports Medicine on single leg balance and mortality risk, guidance from the National Institute on Aging regarding lower body strength and independence, and a randomized controlled trial published in the Journal of Vascular Surgery on calf raise exercise and walking distance in peripheral artery disease. If this was useful, share it with someone who's been told to simply walk more for circulation without much improvement, and subscribe for more research-based guidance on staying strong and mobile after 60.